This class is on panoramic radiography and its anatomical landmarks. The extraoral radiographs most commonly used in dentistry are panoramic images, cephalometric views, and examination of TMJ. The same general principle of thorough, systematic coverage should be used. The thorough examination is best accomplished when a specific sequence of analysis is used. That is, you need to start analyzing the right maxilla, then to the left maxilla, then left mandible, and then finish with looking into the right mandible. This top image is reflecting a composite photograph depicting the osseous anatomy of the maxilla and surrounding bones from the panoramic perspective. So the anterior region is viewed from the front, and while the posterior regions are viewed from the side. So this bottom photograph reflects a panoramic radiograph which is divided to match the regions represented by the photograph. Now let us look into the landmarks here. So A is nothing but your pterygoid plates. Then B is pterygomaxillary fissure. C indicate the zygomatic process of maxilla, and D is the zygomatic arch, and E is temporal component of the temporomandibular joint. Next, F is a mastoid process of temporal bone which is not imaged in the panoramic radiograph generally. And then coming to G, G reflects a lateral and inferior orbital rim. And H, see here, H is the infraorbital canal, and I indicates the inferior concha or the turbinates. So I is marked over here, and this shows the inferior concha, and J indicates the hyoid bone. Almost 30 landmarks are marked in this picture. Let us see one by one. The first one is pterygomaxillary fissure. So in this picture it is given here. So this is the pterygomaxillary fissure. So in this radiograph it is somewhere here. Next is the posterior border of the maxilla. This is the posterior border of the maxilla. You can equate with the same picture here. So this is the posterior border of the maxilla. Third one is maxillary tuberosity. So where is maxillary tuberosity? Here it is here. That is distal to the maxillary molar. In the radiograph it is somewhere here. This is the maxillary tuberosity. Next is maxillary sinus. So this full portion is maxillary sinus. So the radiograph it is somewhere here. This is the maxillary sinus. This is the floor of the maxillary sinus. Next is medial border of the maxillary sinus. So this is the full maxillary sinus I said. So this should be the medial border for the right maxillary sinus, and this is the medial border for the left maxillary sinus. Then is the lateral border. So this is the lateral border of the maxillary sinus. This again is the lateral border of the right maxillary sinus. Next, 7 reflects the floor of the orbit. So this is the floor of the orbit. In the diagram it is shown as 7. Here in the radiograph this is the floor of the orbit. Then 8 is infraorbital canal. So infraorbital canal is seen here. This is the infraorbital canal on the left side. Here on the right side it is the infraorbital canal, and in the picture it is marked as 8 over here. Next, nasal cavity. It is marked as 9 here. So this is the nasal cavity of the right side of the radiograph or the picture. So this is the nasal cavity. Here again in the radiograph, right side of the radiograph, this is the nasal cavity, and the left side of the radiograph, this is the nasal cavity. Next is nasal septum. Nasal septum is in the middle of the nasal cavity. So this is the nasal septum in the picture. And here again in the radiograph, this is the nasal cavity which has the septum here in the middle. Next, floor of the nasal cavity. So this is the floor of the nasal cavity in the picture. Again in the radiograph, this is the floor of the nasal cavity on either side. Next, anterior nasal spine. So this V-shaped radiopacity is anterior nasal spine. Again in the picture, this is the anterior nasal spine. Next is incisive foramen. So incisive foramen is seen in between the maxillary incisor. It is marked as 13 here, the picture, and again in the panoramic radiograph here would be the incisive foramen. But those structure which are in the middle will be superimposed with the spine in case of a panoramic radiograph. Next is hard palate or floor of the nasal cavity. So 14 is hard palate or floor of the nasal cavity. So this is the hard palate. You can see the radiopacity here. This is the floor of the nasal cavity. Next, zygomatic process of the maxilla. It is marked as 15. So in the picture, this is the zygomatic process and this is the zygomatic arch. Again here, this is the zygoma and this is the zygomatic arch. And for the right side of the radiograph, this is the zygoma and this is the zygomatic arch. Next is the articular eminence. So you will have to check here near the condyle. This is the articular eminence and this articular eminence marked as 17 in the picture. Next is external auditory meatus. That will be here behind the condyle. You need to check. There will be some round ovoid radiolucency. So this is the external auditory meatus. Here again you have some superimposition of spine. So here will be the external auditory meatus. Next is 19 is styloid process. Styloid process you will see on either side. So it is somewhere here. So this is the styloid process on either side and sometimes it appears to be elongated and we call it as eagle syndrome. Next is mandibular condyle. I think that you can visualize well here. This is the mandibular condyle on either side of the radiograph. Next is sigmoid notch. Sigmoid notch is marked as 21 here. So this is sigmoid notch. It's between the coronoid and the condylar process. So in the radiograph, this is the sigmoid notch. Next is coronoid process. So you can see the coronoid process. This is the coronoid process. The picture is marked as 22. Next is posterior border of the ramus. So the picture is marked as 23. This is the posterior border of the ramus. Like in the radiograph, this is the posterior border of the ramus. Next, angle of the mandible. So it's marked as 24 in the picture. This is the angle of the mandible. Again in the radiograph, this is the area which corresponds to it. Next is hyoid bone. Hyoid bone you will see on either side of the panoramic radiograph. This is the hyoid bone of the left side of the radiograph and this is on the right side of the radiograph. Next is inferior border of the mandible. I think that you will be very clear. This is the inferior border of the mandible on right and the left side. Next is mental foramen, which is marked as 27 in the picture. So this is the mental foramen. You will see in between the premolars. Next is mandibular canal. You will see on either side a band of radiolucency, which is bounded by radio opaque lines. So this is the mandibular canal, which you will see on the right and the left side. Next is cervical vertebra, which is marked as 29. So this is the cervical vertebra which you will see on either side of the radiograph. So this is on the radiograph you can see the cervical spine. Next is epiglottis. Epiglottis is marked as 30 in the picture. So it is overlapping the hyoid bone. Here again in the radiograph, this is the place where the epiglottis image will be seen. Along with the bony landmarks, you can see the soft tissue shadows in the hair spaces. Marking A reflects the external nose and B reflects external ear. C indicates the tongue image and then D indicates the lingual tonsil on the posterior tongue and then E reflects the epiglottis. E reflects the epiglottis. So that you will see here. And F reflects the soft palate. You can see here F reflects the soft palate. Then coming to the airways, so far from A to F, those indicates the soft tissue structures. Then 1 to 5 is the airway. One reflects the nasal fossa. So here will be the nasal fossa, and 2 reflects the nasopharynx. This will be the nasopharynx, and 3 reflects the oropharynx. So this is the oropharynx. And then 4 reflects the oral cavity. So this reflects the oral cavity, and 5 is the oral orifice. So this is the oral orifice. So this is the oral orifice, this is the oral cavity, this is the oropharynx, and this is the nasopharynx. So this shadow is the nasopharynx. So we'll see about the ghost shadows. Ghost shadows are produced by the contralateral mandible. So this is the ghost shadow of the left mandible, and cervical spine, which are traced on the panoramic radiograph. And the shadows of these structures, they are indistinct because they are so far outside the focal trough when imaged. Next, coming to another example, there is earring which is worn by the patient during the image acquisition will create a ghost shadow. The right earring is seen superimposed over the left maxillary sinus, and then left earring is projected over the right zygomatic arch. So these are the ghost shadows of the earring. Now let us see the interpretation of panoramic radiograph. So we can assess the periphery and corner of the image and examine the outer cortex of the mandible as well as the cortex of the maxilla, and also examine the zygomatic bone and the zygomatic arch, and assess the internal density of maxillary sinus and the structures of the nasal cavity and the palate. Then I also examine bone patterns in the maxilla and mandible, and also examine the alveolar process and teeth. Assess the periphery and corner of the image. So by doing that, we avoid zoning in on the teeth and neglecting important finding in the tissues surrounding the jaws. So the structures that may be seen in this area would be orbit, articular process of the temporal bone, cervical spine, styloid process, pharynx, and hyoid bone. Okay, so examination of the outer cortex of the mandible. So we need to trace the periphery of the bone starting at one spot and completing the circuit. If you start at right side, you need to completely go through the right side, then look into the left side, and you need to complete the circuit. So we'll have to examine the anterior and posterior ramus, then the coronoid process, then condyle and condylar neck, and the inferior border. What we have to look is that you need to look that there is a continuity and there is evenness in the cortex. Next, to examine the cortex of the maxilla. So this includes the posterior and medial wall and the floor of the maxillary sinus. So while examining the posterior wall of the sinus, you need to look as well as the zygomatic process of the maxilla and the pterygoid maxillary fissure. So the thin radiopaque line produced by these structures run roughly parallel to the posterior wall of the maxillary sinus and may be confused with it. So destructive disease affecting the maxillary sinus may erode the posterior wall, which can be easily missed if all the three lines are not identified. So we should be very careful in examining these areas, that is the zygomatic process and the pterygomaxillary fissure. So next, to examine the zygomatic bone and the arches. So we need to follow where they extend posteriorly from the zygomatic process of the maxilla to the temporal bone. So once you start examining the zygoma, you need to continue with the zygomatic arch and also look into the temporal bone if there is any pathology persist. Next, to assess the internal density of the maxillary sinus. So the density of maxillary sinus is going to be totally radiolucent. Okay, so you need to compare the right and the left side, and opacification is most commonly due to any sign of inflammatory disease, but it could be a sign of more serious pathology as well. So we need to be keen in observing the maxillary sinus to rule out if there is any pathology which can present as opacification. Next, assess the structures of the nasal cavity and the palate. We need to examine the nasal floor, hard palate, and the concha extending horizontally along both the sides of the image. and also examine the nasal septum in the midline. And we need to note that soft palate seen bilaterally, which is extending from the posterior aspect of the hard palate and into the oropharynx. Next, examining the bone pattern of maxilla and mandible. So we need to assess the density and pattern of trabeculae for any abnormalities. And we need to keep in mind that some metabolic condition may present with generalized alteration in the bone pattern. Therefore, we need to compare the right and the left side, which might be helpful. Then in the mandible, examine the size, position, cortication and symmetry of the inferior alveolar nerve canal, mandibular foramen as well as the mental foramen. Next, the alveolar process and the teeth has to be examined. So an approach to this part of interpretation is that you need to assess the crestal bone position of the alveolar process to identify if there is any periodontal bone loss. So generalized, you need to look into from the right and the left side of the maxilla and mandible whether there is any crustal bone loss. Then we need to examine the periodontal ligament space and the lamina dura around the teeth for any signs of inflammatory disease. Then after that, you need to examine the follicle and the papilla of any developing teeth for anything affecting their size, position or cortical boundaries. And these changes could be indicating of developing pathology. So if there is any impacted teeth, you need to look whether there is any follicle or if there is any pericoronal radiolucency, and also we need to look into the cortical boundaries. Then to evaluate the teeth for presence or absence or eruptive or positional abnormalities, then you need to look into caries. Then if there is any inadequate restorations, calculus or any developmental or acquired abnormalities. So panoramic image can be divided into 6 anatomical zones. And zone 1 is for the dentition, zone 2 for the nasal and the sinuses, and then zone 3 for the mandibular body, and zone 4 over here for temporomandibular joint on either side, right and the left side. Then zone 5 shows the ramus as well as the spine on either side, the right and the left side. Then zone 6 which shows the hyoid bone on either side of right and left. So we will see about zone one by one. Zone 1 is the dentition zone. So we will see the teeth arranged with an upward smile curve, and the anterior teeth should not be too large or small. Posterior teeth should be evenly sized without excessive overlap. Then apices or the crown of the teeth should be visible. In zone 2, which is the nose and sinus zone, the inferior turbinates and surrounding airway spaces will be visible, and soft tissues of nose should not be visible here. Then shadow of hard palate will be seen in the maxillary area, and tongue should be in contact with the hard palate. Next is zone 3, that is mandibular body zone. Here you will see the inferior border of the mandible, which should be continuous and smooth, and there should not be any ghost image of the hyoid in the mandibular body, and the midline area should have a proper proportion. Zone 4 is condylar zone. So condyle should be centered within the area of the zone, and condyle should be of equal size on the same horizontal plane. Next is zone 5, that is the ramus in the spine zone. The ramus of the mandible should be having a similar width bilaterally, and the spine if seen may be present as long as it doesn't superimpose over the ramus. So even if the spine is there, it's fine, but it should not superimpose with the ramus. So if the spine is present, then the distance between the posterior border of the ramus to the spine should be equivalent on both the sides, both the right side and left side, it should be equivalent. Next is the hyoid bone zone. The hyoid bone should appear as bilateral dermal image with equal proportion. The hyoid image may touch the mandible but should not spread across it. So understanding of the panoramic anatomic landmarks is essential for accurate interpretation of the radiograph. So these landmarks provide critical reference point for diagnosis, treatment planning and identification of normal versus pathological condition. So you should be familiar with bony as well as the soft tissue structures, which will help the clinician avoid misdiagnosis and will ensure optimal patient care. And imaging technology continues to evolve, and a solid grasp of these foundational landmarks remains a vital skill in clinical practice. Thank you for your patient listening.